Hi guys, welcome back to the channel. So officially we are in 2026. Happy New Year guys. Hope you had a great New Year Eve. So we'll have started teachers calling syndrome in last class, or we should call it last year. So we'll be continuing that with the diagnostic workup. Okay, let's start. Diagnostic workup, clinical recognition, reconstructive surgical planning requires cephalometric tracing and CT scan. A complete audiologic examination are required क्योंकि conductive hearing loss होता है. Now coming to the treatment is the treatment protocol revolves around reconstructive surgery. Okay, middle ear reconstruction to restore as much as conductive hearing as possible. Hearing aids may be required. Orbital reconstruction and the zygoma deficiency may be approached with cranial bone grafts, alloplastic implants, and or distraction osteogenesis. Zygomatic osteotomies and Leaford 2 type osteotomies are other approaches that have been used to correct the midface and zygomatic maxillary complex. तो ZMC के लिए हम लोग mainly Leaford 2 osteotomies use करते हैं as a treatment plan. Now, the lower eyelid can be improved with a cross eyelid flap and a lateral canthus repositioning. The mandible and the maxillary hypoplasia usually required extensive pre-surgical orthodontic arch coordination followed by a Leaford 1 or Leaford 2 osteotomy and mandibular ramus osteotomies. So mainly the treatment plans revolves around reconstructive surgeries and osteotomies. Okay. Now coming to prognosis. Reconstructive surgery can greatly improve the self-esteem and quality of life. However, multiple stage followed by revision are the rule. Okay, the multiple stage surgeries followed by revision is the rule और ये improve कर सकता है quality of life. Reconstructive surgery. Okay. Now that's what all about Treacher's calling syndrome. We'll be starting a new syndrome that is golden hair syndrome spectrum. Okay, it is known as hemifacial microsomia auriculovertebral dysplasia. Auriculovertebral dysplasia. Okay, that is golden hair syndrome. Now coming to its clinical presentation and pathogenesis. Okay, I'll be telling you that this will be the last of syndrome in developmental disturbances. We'll be dealing with one more topic that will be epidermolysis bullosa and types of epidermolysis bullosa, and then we'll be shutting this topic and I'll be taking break of 1 to 2 months as I have informed you all earlier due to personal reasons. So I'll be back in channel with new topics after 2 months. So I'll be finishing this developmental disturbances with all the syndrome I have dealt. This is the last syndrome and one more topic is left in the syndrome, that is epidermolysis bullosa. I'll be completing that also, and then I'll take a leave. Okay, now coming back to the topic. Coming to the clinical presentation and pathogenesis, hemifacial microsomia refer to varying degree of hypoplasia or agenesis of mandible condyle and rami, hypoplasia of temporal fossa, hypoplasia and the encroachment on the interarch space by collapsed mandible. So mainly there is the hypoplasia or agenesis. Okay. Now, about 10% of individuals also have a complete cleft lip and or palate. The facial cleft is usually a mild extension of the ipsilateral commissure. मतलब lip पर से जाता है cleft. The ear malformations are similar to seen in mandibular facial dysostosis, that's a Treacher's calling syndrome, and are associated with conductive hearing loss also. Okay, that's all for today. We'll be continuing this in the next class. Till then, like, share, subscribe, and comment. Bye.